indeed a pleasure and a privilege to introduce one of our fellow Rotarians, Dr. Prasad Dandekar. Dr. Prasad heads the Radiation Oncology Department at HN Hospital. A highly qualified professional, Dr. Prasad has done his MD and later he was trained in oncology from Tata Memorial Hospital, followed by the Royal Marsden NHS Trust, London. He has done Executive Postgraduate Diploma in Hospital Administration from Tata Institute of Social Sciences. He is a trained counselor with a diploma in integrative counseling. Dr. Prasad is a certified professional coach from International Coaching Federation. Dr. Dandekar has 20 years of experience in field of oncology with a unique experience of starting 3 new radiation oncology centers, which in itself is a great achievement. He has been instrumental in organizing excellent academic programs in the realm of oncology to promote evidence-based medicine. He has developed holistic oncology services for the patients involving tumor boards, rehabilitation services, yoga therapy, counseling, etc. His coaching practice focuses mainly on coaching for the members of LGBT community, cancer patients, and medical professionals. His focus in the coaching is to inspire them to succeed in their professional and personal lives. Dr. Dandekar is a recipient of prestigious Ananta Aspen Leadership Fellowship and is a part of Aspen Global Leadership Network. He lives with his partner. He's a proud gay man and is a strong advocate of equal rights for the LGBTQ community. Over to you, Dr. Dandekar.
Thank you, Mr. Paranspe. So in the November of 1998, I was 20 years old and my father was exactly as old as I am today, 43. And he fainted while he was getting down from the train. We took him to the hospital and the doctor suggested we do a CT scan. And after doing the CT scan, the radiologist came out and told me, your father has brain tumor, and walked away. I was still doing my MBBS and it was such a shocking diagnosis for me. And it was delivered with such casual approach to me that, your father has brain tumor and, the doctor just walks away. And it was quite terrible. We had to then subject him to surgery. And after that, he also had a relapse of the tumor, which then needed radiation at Tata Memorial Hospital. And that is how I got into oncology field. That is how I got introduced to oncology field. And I'm quite passionate about what I do, not only because I care for my patients, but I have seen it from the other side of the table as well. And hence the talk today about winning the battle with cancer. Now, in every battle, there are two parties involved. So in this battle, there's cancer, and on the other side, there's patient and their family members and their loved ones. And every cancer talk you would hear will be about cancer, not this talk. Today, we are going to talk about patients and their families. What can we do to empower patients and their families to win this battle better, rather than focusing on what the cancer does and how do we, tame the beast? Now, what we will do is I'll go through the slides. If you have any questions, I request you to either post them in the chat box or we can take the questions at the end of the session. So one of the first battle that the patient's family and patients face is the medical advice. Where do you get the information? You get diagnosed with cancer and then you're suddenly faced with a problem which you have never imagined or seen before. You don't have enough information about it. And then there are a lot of conflicting evidence. Should I do chemotherapy? Should I do surgery? Should I do radiation? What do you do? And which are the specialist doctors? So for example, you have some gynecological problem, you go to your gynecologist and you suddenly get detected with a gynecological cancer. Then what do? Whom do you go to? And then what are the center of excellences? How do you take second opinion? And then you get conflicting opinions. And this sort of thing gets the patient very confused. Now, how do we tackle this problem? So one of the first advice that I have for everyone is to educate yourself about the cancer. Now, there are incidences where the diagnosis is made in such a way that it is a medical emergency, that you have to act now. But on almost 95 to 98% of the times, it is not an emergency. It's an urgency where you have to act urgently, but it may not be like you have to act right now. Take a breath, take a step back, educate yourself, read online and read from good resources, from good hospitals, good university hospitals across the world. Find out what exactly is happening latest in these fields. When it comes to specialist doctors, make sure that you're meeting the right doctors. So you're meeting an oncologist and not a generalist. So for example, if you have a gynecological cancer, go to a gynae oncologist. If you have, say, cancer of the head and neck, rather than going to an ENT surgeon, go to a head and neck oncologist. And in the city of Mumbai, at least, we are very lucky that we have a lot of specialists available who highly specialize in each of these fields. Find out hospitals which are center of excellence. Now, this is very, very important because therapy of cancer cannot be delivered by one individual. It is always a holistic approach, always a teamwork. So go to places which have teams available. So you have surgical oncologist, radiation oncologist, medical oncologist, a good radiologist, a good pathologist, a good rehabilitation center. These are the basic minimum needs that each hospital needs to have. So make sure that you're going to a center of excellence where all these facilities are available. I always urge to patients, please take second opinion. So your doctor may give you the right advice, the best advice that the doctor may think, but sometimes the doctor may be wrong. Sometimes the doctor may not understand your needs. You may have different needs. So please take a second opinion, again, from somebody who's an expert in that field. And as I said, it's okay if it takes few days in getting this second opinion and other things. And if you have a conflicting opinion from one person to another person, then you may have to take a third opinion. So taking the right medical advice is very important, because what you do in those first 1 or 2 weeks after the diagnosis will determine the outcomes. Say, for example, if the right treatment for this patient is chemotherapy and radiation, and if the patient undergoes surgery for whatever reason, the outcomes actually may worsen. So be very careful about this. So keep in mind that medical advice needs to be sought properly. And if you take time for that, that's fine. Cancer causes a lot of physical changes. So the treatment itself, if, for example, somebody has a tongue cancer and the tongue is removed, which means the patient may not be able to eat properly or speak properly. So it creates a disability. It may create disfigurement. Some part of the face may go missing. Somebody may have a missing arm or missing breast, which may lead to body image issues. So people may find it very difficult to deal with these issues. They may have lack of stamina. So a person who may be able to work for, say, 8 to 10 hours a day may, after the treatment, may feel that, no, I feel very tired, I can't deal with this, and they may need assistance. Now, this creates a lot of problems for the patient, because somebody who has been very independent all their life suddenly needs assistance. That will cause problems. So they may not ask for assistance, which may lead to further complications. So for example, somebody who's finding it difficult to walk because of maybe a brain tumor does not take help and then has a fall and then has a fractured pelvis, then you have just increased the complications and increased the treatment. Many of the patients also experience a lot of weight loss because of the high metabolic state that the body gets in because of cancer. So these are the physical challenges that the patient may face, and we need to identify these challenges and also help them out. So for example, if there's a disability, can we offer them good physiotherapy or speech therapy to improve that? If there is disfigurement, can we check what can be done for that? So for example, if you are in a center of excellence sort of a setup, a surgery which may otherwise cause disability, if they have a very good plastic surgery team, that could be avoided. For body issues, image issues, we may have a counselor on board who can help the patient or even simple things like a prosthesis. Somebody has removed a breast because of breast cancer and finds it very difficult to go out in public now. We can give her a breast prosthesis, which she can put inside her blouse or dress, and people cannot make out that she has had breast cancer surgery. So simple things like this, then gradually improving your stamina through physiotherapy and exercises, and asking help when required. That is again very, very important. But the most difficult part, I think, of these changes are the emotional challenges that the patients face. When you hear the word cancer, the first word that may come to your mind, or for at least many people's mind, is death. While death is the ultimate truth about our life, we are very, very scared of death. When you talk about cancer, people feel really scared. They feel, what am I going to do? I haven't lived my life enough, or my family needs me. How will they manage? So there's a lot of anxiety that gets created around this. There could be fear of treatment. This very morning, I was seeing a patient, a young, fit lady, has a gynecological malignancy, had just started her radiation 3 days ago. She was crying in my OPD, saying that I feel very scared when I go down to the radiation department. She was absolutely fine sitting in front of me on another floor. But when she goes to the radiation department itself, she feels very scared and, as if she can't breathe. Now, this is fear of treatment. And she said that I understand that this is irrational fear because I've seen how simple the treatment is, how the treatment is being delivered, and all of that. But there is that fear. And patients who complete the treatment may then live under the shadow of fear of recurrence. I see so many people for years after completing their treatment living continuously under the fear, will my cancer recur? So if they have one bout of cough, they feel, oh my God, my cancer has come back. Or if they have feel a little tired one particular day because they worked very hard, they feel, oh my God, my body is going down and I may have relapse of the cancer. And that's not a nice space to be in, because then you're not really living your life, you're just surviving. So what do we do about all these fears? And my advice would be, we take help of a good mental health worker, a counselor, and in some certain cases, even a psychiatrist if required. We need to employ their services to take care of whether anxiety, depression, or whatever it may be. In most cases, these are temporary changes and they abate after the treatment is over. But there are many other emotions that surface. It could be anger. Why is this happening to me? I have never had alcohol. I have never smoked. I have never even eaten non-vegetarian food. Why do I have cancer? I've always been good to people. I have been such a nice person. Why is this happening to me? Why am I being punished? So there could be anger about diagnosis of cancer. And as you're aware that there is not much we can do about that anger. Anger is actually a very disabling emotion, which will make their treatment so much more difficult. So again, anxiety, anger, depression will need some sort of a mental health support. There's a lot of stigma around mental health support in our country, unfortunately, and across the globe. But I'm a great advocate of seeking help. I have a counselor. I have actually two counselors on hold. Whenever I need, I speak to them. I have a psychiatrist I speak to often. I have a coach on call. If I have a problem, I speak to my coach, because I understand how important my mental health is. And if I need help, I seek help. If I'm unwell today, I've had some minor surgery on my foot. I didn't say, oh, that's just a minor problem, it will go away, no need to do anything. No, I went to my surgical colleague. I told him we had that surgery this morning, and I'm happy I took my help. Similarly, if I have a mental health problem, I will go to my counselor, I will go to my psychiatrist. And that's something that we need to start, and we need to really get comfortable with asking for help. But another strange emotion that sometimes people feel is the survivor's guilt. Now, this is a patient who has had cancer, has had successful surgery, radiation, chemotherapy, whatever the treatment may be, and has survived the cancer. That person is doing well. And they feel guilty about that. They feel, oh my God, there are so many people who are not doing well. There are so many people dying because of cancer, and I'm surviving. So I must be doing something. I must be cheating. There must be something wrong. And that leads to survivor's guilt. Again, this also needs a little bit of a support from a mental health professional. In a country like India, there is a lot of stigma and shame around cancer. He must have done something wrong in his past life, so he had cancer. Things like that. So, and there is also a fear of isolation, that now I have cancer, I can't meet new people, or I can't meet my friends, or I can't socialize. Like somebody who has, as I said, tongue cancer, for example, that person is not able to eat. So he can't go out with his friends for a dinner. The doctors may tell them that you can never smoke or you can never drink. So they can't socialize with their friends. And many people fear pity. They don't want to go out and meet their family or friends and acquaintances because they fear that they will pity them. That, oh, poor you, you had cancer, how are you? And that is not a nice thing to happen again. Many people fear the fear of pity as well when it comes to social engagement. Cancer also has an impact on relationships. Patients will feel guilty that they are causing inconvenience to their family. They have to come, somebody from their family will need to escort them every day to the hospital, or they will, have other inconveniences. Sometimes cancer changes family dynamics. The man or a woman who was the head of the family now has cancer, and then that person sort of loses control on what happens in the family, and that may cause a lot of dynamics changes in the family. If there are already differences in the family, they may get amplified. One person may say, I had a patient who had three daughters, one in the US, one in India, one in the UK, one in Singapore, and they couldn't see eye to eye to each other, and the father suffered tremendously because of that, because the sisters just couldn't come on agreement of what happens to him. He was finally flown down by an air ambulance to London, only to die there in 2 days. It was terrible. So the amplification of differences will also happen because cancer causes stress, and stress causes all these problems. The other issue many patients face is overprotectiveness of the relatives to avoid guilt. That I should not feel that I didn't do enough for my mother, so I will do everything for my mother, even if it means that my mother suffers. So we have had patients where the patient is dying, unfortunately, because of cancer, but the patient's family will say, "Nee, doctor, aap jo bhi hai, sab karo, sab karo, sab karo." And we try to plead with them, saying that this is the time to say goodbye. Let them go peacefully. Don't harass them by putting in needles and tubes and ICU and ventilator. But because they subconsciously feel that I should not feel later that I did not do enough for my parents or my spouse or whatever, it causes problem for patients. So what do we do here? We need to focus on the patient. Everything needs to be patient centric. And we need to ask that question, whatever we are doing, is this the best thing that we can do for this patient? And if not, then maybe we should not do it. If you have disagreements within the family, but can we come together for this particular cause and come to an agreement? Another taboo in India is sex. So cancer and the treatment itself can cause problems such as infertility, impotence, and especially in younger individuals, infertility can become a huge problem. That somebody has just got married, is expecting to have kids, and then you have a cancer which is going to cause infertility. Or somebody who's even in their 70s has prostate cancer, is sexually very active, and has impotence. What do? It causes a lot of emotional, social, physical problems. Again, leading to body image issues. There could be decrease in enjoying the sex, the libido part of it, where you desire sex, that also could go down. And in some patients, there could be fear of intimacy. So for example, a woman who has had treatment for gynecological cancers, and suppose she has had radiation for that. Now that causes dryness of vagina. Now in that situation, if the woman and her partner tries to have penetrative sex, then it can be quite hurtful. So we advise them to use various lubricants, water-based lubricants, to before they engage into penetrative sex, to make sure that it does not cause pain. It may also cause shame. Somebody has had, say, mastectomy, and then they may feel ashamed to even undress in front of their partner. So, and then there is, of course, the guilt that I am not able to give the same amount of intimacy to my partner. So cancer and the treatment itself can cause a lot of sexual problems. Now, how do we handle them? Number one is we identify them. And number two, most important, is we voice them to our doctors as well as to our partners. So, I remember this gentleman who was 76 or something, prostate cancer patient, and we were discussing his treatment. And he said, Doc, I don't want to take hormone therapy. And I said, why? I mean, hormone therapy is a part of this treatment, and it's not a big deal. It's fine. So after a bit of a going back and forth, he said, Doc, but I don't want to lose my sexual appetite. I want to continue having sex. I'm 76. I want to enjoy my life. So then we sort of discuss that. What is important for that patient? I may feel curing the cancer is the most important thing for the patient, but the patient may feel, no, I want to continue having good sex and then also cure my cancer. So we reached an agreement. We said, okay, we'll do short-term hormone therapy for you, which will lead to sort of a problem for only maybe 6 months. And after that, you can get on with your life. So it's important that you discuss it with your doctor, because the doctors will not know intuitively. Now, the other set of problems. Sorry, I think Shripad will need to set in and mute few participants. Yeah, okay. The other set of problems that we have are career-related problems, that the person may lose a job or may become handicapped. Like suppose somebody is in a job where they have to talk and they have a laryngectomy or removal of the larynx or vocal box for cancer treatment. Then what do? They will lose their job. They may lose job because of the leave that they have to take for cancer treatment, or their family members may lose their job because of the leave that they have to take for the patient's treatment. There could be loss of income. Like suppose, I get so many patients who run their own businesses. Like, there's a small shop that you're running and the person is ill. So the shop owner is coming for treatment and his son or daughter is also coming for treatment. So there's nobody to run the shop. So the shop is closed. So those sorts of problems also come. So it is important for us to help patient on this. So I many times offer them that, maybe I could write a letter to your employer asking them, extended leaves or whatever that they need and things like that. Normally, I insist that, at least one person should accompany the patient. So suppose if there's a situation where the family member has to run the shop, then we would say, okay, you can come to the hospital, bring your maid with you, rather than coming on your own, rather than coming with the family member, and we'll take care of you. So things like that have to be done to ensure that the patients are comfortable at the time of the treatment. The other problem that may come, especially in the corporate environment, is discrimination. When it is time for appraisal and when it is time for promotion, the boss may say, Jane do, he has cancer or she has cancer. Maybe what if her cancer relapses? We give her a position of authority or something senior level position, and then she takes 6-month leave. That let's not promote her. Now that is a terrible thing to happen, because they have worked very hard on their job and they have battled with the cancer, and then now they are discriminated. So these sorts of, and this discrimination may happen in a very sort of a overt way, or it may even happen in a covert way, where the boss may think, maybe she's not ready yet for promotion. It will cause too much stress. But at the back of his mind, he's thinking, no, the cancer may come back and this will cause problems. So those sorts of things also we need to be aware. And I request the patients and the family members to discuss these things with their doctors. So for example, in this situation, I would issue a letter to a patient if the patient is completely cancer-free, saying that I have examined this patient on this date and this patient is completely cancer-free. And then you show that to your boss. So those sorts of things also may need to be done. Caregivers bear the brunt of it. The cancer patient is going through a lot of trauma, but the patient's family members goes through a lot of emotional trauma as well. So they have to manage the patient's physical needs as well as psychological needs. And there may not be open communication between the family members. It is almost a routine process for me that the patient's family member comes in and tells me, उनको कुछ मत बताना, उनको कुछ मालूम नहीं है कैंसर के बारे में. And when they are away, the patient says, Doctor साहब, कौन सा कैंसर है, क्या स्टेज है, बताओ मुझे. So that lack of communication creates problem, because then the patient feels more in isolation. So they are suffering from cancer and they have no one to talk to because their family is completely denying even the diagnosis of cancer. So that's a bit of a problem. So the communication between the family member needs to be open. You don't have to tell them that, Dad, you have cancer, you're going to die in 6 months. That's not the way we communicate. You can tell them that, okay, we have a problem, we have cancer, we are working on it, we found the right doctors for it, we are here to support you, let's see what happens. So those sorts of things we need to do. And the family members may also have a lot of anxiety and fear about losing their loved ones, and also worried about how do they take care of themselves, how do they look after themselves. So those are the problems that the caregivers will be feeling. And then the most difficult relationship anybody can have, as somebody was mentioning even before, the relationship with their doctors. We as doctors are very busy. So the patients are scared to ask questions. The doctors may not be able to give you ample amount of time. The doctors may not be upfront in telling you all the side effects and outcomes also, because they may feel that maybe the patient is not ready. Now, what I do generally is I don't bombard the patient with all the diagnosis and treatment at the same time. What I do is I tell them treatment and the basic side effects of them, then I give them some reading material. And then when they come back to me for the next appointment, we discuss more in detail, because if you download all the information in one go, the patient is just going to get overwhelmed and not remember anything. So my suggestion here is that if you are meeting a doctor, spend some time at home. Make a list of all the questions that you have. Take it with you and ask those questions to your doctor. If your doctor refuses to answer your questions, change your doctor. That's not the doctor you want to work with. Okay, so get all your questions answered. The other issue that we are facing now is lack of trust, because there's so much of the doctors are doing this just to make money. I don't trust the doctor. I find it very difficult to do. So again, here is the role of taking second opinion. And my suggestion here is always work with doctors and the hospitals whom you trust. Trust is very, very important, because you may go through the entire treatment, and then if you don't trust the doctors, you may feel maybe they didn't do the right job. Maybe my cancer will come back because they didn't do the right job. And that's a terrible state to be in. So find doctors and hospitals whom you trust, whom you like, and work with them. That's quite important. Now, when it comes to doctors trying to not give you time, is primarily because we're generally busy, because there's so many patients. The second is also, to a certain extent, self-preservation. I don't generally want to be friends with my patients, because at some point, if they have complications, two things will happen. If they have complications or relapse of the disease, two things will happen. One is, if they're very close to me, then it will break me emotionally, which is not good, again, because I have to be available for other patients. The second and most important thing is that if my patient is my friend, then my objectivity of taking the decision may go down. So I have treated some of my very close friends, relatives, and every single time I ask another doctor to step in and evaluate the entire plan and the treatment I have made, because I may get so emotionally overwhelmed by the whole thing that I may take wrong decisions, and that's not good for the patient. So your doctor needs to be a good doctor. Your doctor does not need to be your friend. It's a very different relationship. It's a professional relationship, and it's a relationship which should be based on trust rather than friendship. When we reach a point where we cannot cure, we have to palliate. What is palliate? Palliation is treatment of the symptoms. So you may not be able to cure the cancer, but you can help the patient to be comfortable. You can help the patient to be pain-free. I generally work with three principles. The patient should be pain-free, patient should be eating reasonably well, and patient should be reasonably happy. If we achieve these three things, that's good enough, you know. So, but the problem is we don't have very many palliative care specialists. There's a lack of home care, although now we are seeing some home care facilities being available. In case of severe pain, we need to give narcotic drugs like codeine and morphine, and the availability of these drugs is very poor. Fortunately, in Mumbai, we do have them available easily, but outside Mumbai, in smaller places, it's really, really difficult. The other issue is that the family physicians are not trained in palliative care, so they don't understand. It was just last week when one of my patients who's really critically ill, and we have sort of put her on palliative care. Um, we can't really help her, but we are working on these three parameters. The general physician, visited her at home, and she was looking a little sleepy. So he asked for blood test. And the blood test result showed that her sodium level is slightly low and potassium is slightly high. So he said, no, 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 you admit her in the hospital. They admitted her in the hospital, and she was put in the ICU. And after that, the family called me up. So I told them that the painkiller medication that you're taking is causing that drowsiness. And the slight changes in potassium and sodium are not really to be treated. And this patient will not benefit from ICU. If she has, say, 2 months to live, she should spend those 2 months with her family at her home in her bed comfortably. So then they chose to discharge her and take her home. Another complex relationship we have is with death. As I mentioned, that it's the ultimate truth, but the fear of death and the denial about death is something which is universal. I often insist on discussing sort of paperwork sort of thing with the patients, in the sense that if I see a patient who's terminally ill, I ask the patient that, do you have any unfinished businesses that you need to finish? Is there any paperwork that you need to do? Do you need to write a will? Do you need to finish your bank things or other? Many of them are so much in denial. They will say, yeah, doc, we have time. We'll do it. We'll do it. And it leaves such a mess behind if we don't do these things in time. Of course, fear of death also leads to a lot of anxiety and anticipation of what is going to happen, what will happen to me. And then it's a weird paradoxical situation. Then we wonder, is this patient living, or are we prolonging life here, or are we prolonging death? The person is not living at all. They are just thinking about that death. And then whatever treatment we are doing is just prolonging that death rather than prolonging life. So living, even when we are dying, is something that we need to think about. It's not an easy thing to think about. It is not like, to give you a very personal experience, when the pandemic started last year in March, I realized that I may not make it. I may die. I'm a healthcare worker. I went to hospital every single day. I may die. So I told my partner in a very dispassionate way, you know what, I think I should write my will. I said, okay. And I sat down and I said, I'll write it by hand. It took me 1 week to write those 4 pages. It was horrible. It was horrible. I couldn't come to write, when I die, la 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 should happen. It was one of the most difficult things. I cried a lot. Now, this is me who deals with death every day, who's completely aware that I'm going to die at some point. But it was still extremely difficult. While I kept saying that, I've done enough, I'm ready to die, I am not. I'm clearly not. So most of us are not. So this is a very complex relationship, and we need to be aware about this complexity. The easiest thing for us is to tell patients, smoking chhod dena abhi, no drinks from now, and we wash our hands of it. You've got cancer because of smoking, you need to leave smoking. It doesn't work that way. Addictions are very different from habits. You can change a habit very easily, but addictions are difficult. So it causes psychological withdrawal symptoms. It may cause physical withdrawal symptoms. And there is a lack of support for de-addiction. So we don't have very good de-addiction centers available freely. And there may be lack of motivation. Like somebody may say, "Arey yaar, abhi to ho gaya na cancer. Abhi kya karna hai? Chhod do. Let me drink and let me smoke and make merry." And some of them go to the other extreme. They feel continuously guilty for doing what they have done, because they may say, because I have smoked for so many years, I have cancer, and because of that, my family is suffering now. So there are very, again, complex issues come with the addiction. This reminds me, one of the things that people do is that, like, at some point recently, I had a patient who had smoked for nearly 40 years, 2 packs a day, has a very advanced lung cancer, non-curable, and we are just trying to help him with pain. And he and his family tells me, "Doc, आप तो भगवान है, आप ही बचा देंगे हमको." I said, "No, I can't. First of all, I'm not Bhagwan. I'm just as human as you are. And what has happened over the last 40 years cannot be undone just because you have come to the doctor." And these are the patients who, when the patient dies, unfortunately, will say, "This doctor is very bad. He didn't save my patient." So that's also, I think, one way of emotionally dealing and delinking yourself from the problem, causality of the problem. But that's something, again, you need to think. Your doctors are not doctors are not gods. They're as human as you are. We also feel the same pain and anxiety and everything that you feel. We're here to help. Beyond that, we cannot do anything. And of course, मेरे चाची के लड़की के बहन के भाई के नेबर को ये हुआ था, उसने वो झाड़ का पत्ता खाया और उसका कैंसर ठीक हो गया. This is the everyday story in my opinion. Everyone will descend on your home and give unsolicited advice. They will tell you about misinformation about treatment. They'll tell you misinformation about treatment side effect. Routinely I see patient, मेरे नानी को कैंसर हुआ था ना, उसको रेडिएशन दिया था, इतना साइड इफेक्ट हुआ, मर गई उससे. I said, when was that? 30 years ago. I said, what phone were you using 30 years ago? I didn't have a phone. I said, the technology has changed. Everything has changed. The medical science is changing so rapidly that you have to be aware of it. Look for proper evidence. When you are searching for evidence, look for something which is proper, which is current. Don't go in the past and try to take this thing. Another problem is alternative therapies. Homeopathy, Ayurvedic have their own, that's a completely different topic, whether they work or not. But very routinely, we get patients. In fact, this morning I saw one patient who had a very small parotid tumor in 2004. And then she had a relapse of the tumor 3 years ago. And for 3 years, her homeopathy doctor is treating her. And now the tumor is so large that she had to undergo complete surgery of this space. And now we are giving radiation. So that's another problem, that misinformation by the alternative therapy, or rather the promoters of alternative therapies. So I've covered that. Many people are just selling hope, and that's a big problem. Now, there are many medications within probably Ayurveda, homeopathy, or any alternative therapy that may help. But I, like, as an oncologist, I don't understand. So when somebody asks me, "Doc, should we take these medications?" My homeopathy doctor has suggested. I said, "I don't know. I don't understand homeopathy. So if you want to do it, I suggest you do it once we complete our therapy, so that there is no cross problems." I remember when I was in Tara Hospital, my research was on what we call as a hemibody radiotherapy. So advanced stage breast cancer and prostate and lung cancers, where we were treating literally half of their body with radiation because the cancer had spread so much. And I had a young lady called Smita who was under my care. And she was doing quite fine. We treated her once, then she got better. We treated her the second time, she got better. And then her blood counts dropped. Her blood counts dropped to the level where it was just impossible for us to even keep her alive. She was admitted in the hospital for 6 weeks. And we just could not figure out what was happening until one day when we discovered that she was on some Ayurvedic medications from, I think, Nasik or somewhere. And so we sent those medications for analysis, and those medications had mercury in it. And that mercury had literally killed her bone marrow, and her counts were dropping because of that. She made it through it, and she eventually passed away a few months later. Before she passed away, she gave me a very beautiful Ganpati. And that Ganpati still is in my office, and it reminds me of her, and it reminds me of the bond that we had. It was quite wonderful. The other toxicity that happens because of treatment of cancer and cancer is the expenses. The penetration of health insurance in India is still quite poor. Cancer and treatment may cause, of course, they're expensive, they may cause loss of income to the patient or the family members, and these things need to be really managed. So I really urge, if you don't have a health insurance, please take health insurance. Please take it for a decent amount of money so that you are not left with problems when, suppose if something like this were to happen. I'm not a very spiritual person, I'm not a religious person for sure, but most of us are. And cancer and its diagnosis may make us question our own spirituality, our own beliefs about life, our own beliefs about death. Like somebody may say, I've been such a good person, why do I have cancer? Our relationship with God may change. Our religion may change. I find that most people find strength in religion and God or whatever their belief system may be. And it's wonderful. If you find your strength from that, then draw that strength and use it positively. So to summarize, these are some of the battles that the cancer patients face. And I'm sure there are many cancer patients on this call who will probably say, there are other problems also. This is just the tip of the iceberg. And we need to be aware of it. We need to be ready to handle all these treatments. And how do we do that? We do that by taking a holistic approach. Cancer therapy is not offered by one oncologist or one doctor. There are oncologists, there are other type of doctors, there are psychiatrists, mental health workers, palliative care specialists, physiotherapists, yoga, the caregivers, of course, the insurance providers, family members, spiritual leaders. Everyone needs to be woven into this web. And the web that we sort of weave with all these people will be the one that will support the patient. So denying that these things are not required will only cause problems. So ask for help from more and more people. Get that help. Derive that positive energy from wherever you get it, and that will help you to deal with these things. Treatment of cancer, diagnosis of cancer is like the sword of Damocles. It's continuously overhanging on your head. And all these precautions that I mentioned will hopefully save you from that. Thank you very much. So if there are any questions, we could take the questions right away. Yes, Dr. Murli.
Dr. Dandekar, a pleasure to listen to you as always. My question is, why don't we have case conferences for cancer patients? Which I have seen in some centers for persons with disability, the occupational therapist, the physiotherapist, the doctor, the psychiatrist, they all meet and discuss our case holistically. And what I have seen in practice is now, the oncosurgeon will send us to the medical oncologist, who will send us to the radiation oncologist. But if they sit together and look at the case, I think it'll be much more effective. So why is that not happening?
Absolutely, you're spot on. And what we call that is tumor board or multidisciplinary meetings. Like when I was in Tata, we were doing that. When we were in Marsden, when we did that. And that is exactly what I started when I joined Alliance. So in our hospital, every Tuesday, 9 a.m. to 11 a.m. is multidisciplinary tumor board meeting, where there are around 20 doctors who join and discuss patient care. Now that is a formal way of doing it, where we actually have slides, each patient's records are put in, and there's a debate as to what is the right thing to do for this patient. Should we do this? Should we do that? Why is it like that? And then that is told to the patient. But in other cases where suppose, what you probably have experienced is a patient is referred from outside Then we will have possibly an informal tumor board discussion where I will call up the doctor and I'll say, okay, doc, you referred this patient. This is what I think. What do you think? Is this what we should do? Is this what? And so those sorts of conversation may happen. Very often we do like a conference call between 2-3 doctors and the patient. So that is the important part about having a multidisciplinary approach. And you're absolutely right. Now, why doesn't it happen in India like it happens somewhere outside? Because our hospital systems are different. Like Tata Hospital, everybody is a full-time doctor. So everybody comes to tumor board because that's the thing that they need to do at that particular time, on that particular day. In India, many doctors are visiting, so it becomes a problem. And in our hospital, we used to do our meetings physically in one of the auditoriums. With COVID, we shifted it on Zoom. And it's been wonderful because earlier we were having 10-12 doctors joining in because somebody was in OT, somebody was here, somebody was there. Now on Zoom, everyone is there because even if they're traveling from one hospital to the another hospital, they're joining on their phone. So it's really working. So that is one positive thing that has come out of COVID, I would say. But yes, you must go to the hospital where such a combined approach is offered.
Thank you.
Any other questions?
Hello, Dr. Dandekar.
Yes, Savita,
I'm
please.
Savita Datta here. You have explained everything so well, very nicely. And these meetings which you have just discussed, we were having that at Vadia Hospital, where you see we went around meeting patients, speaking to them, talking to them, knowing their problems and all that, and then come and discuss with doctors so that they can handle those people more carefully and nicely. And whatever the problems were, their solutions were, you see, thought of and given the responsibility to different people to handle these patients properly. So that way, few hospitals are doing this.
Absolutely. And you know what happens, Ms. Savita? Most of the times, patients are not able to discuss their maybe social problems with the doctors because the doctors are not receptive, doctors may not understand, or doctors don't have time. And that is where the role of caregivers such as yourself and the various NGOs that work in this space comes in. So, you know, they will liaise between the patient and the doctors. So in our hospital, for example, we have sort of, you know, some of the staff, like our therapist, will try to chat up with the patient when they're going in for therapy. And sometimes they call me up saying, boss, you know, they're saying this is a problem that they may have. Maybe they have not spoken to you about it. Can we do something about it? So it's very important to have that network also, which talks to patients in an informal manner and unravels what the problems that need to be solved.
It helps since we are lay people. We are from outside the medical this thing. So they, you see, speak to us from their heart, whatever they are feeling, what they are going through. So doctors can treat them properly when we discuss these things with doctors.
Yeah. So this terminology of lay people is something very common, and I'm not particularly happy about that term because, you know, it is finally our health. And we need to be, as patients or their caregivers, need to be empowered to handle this. So many times what happens is the doctors will first of all instruct the patient. You must do this, get admitted now and we will do this. I'm not very fond of that approach, that you need to give options to the patients. And the patient needs to be empowered. So like, for example, on my website, there's some 17-18 page radiation information brochure. So I insist that everybody reads that first, that you read it, you understand what you're getting into, then find out what are the questions that you may have. It is patient's choice. Patient chooses, and the patient needs to be empowered. And internet has actually democratized knowledge. So make use of that. Read about it from credible sources and then come up with questions to the doctors. Doctors, again, to reiterate, doctors are not gods. They cannot tell you what to do.
Very true.
You have to agree.
Very nice. Thank you very much, doctor. Very well explained. Thank you.
Any more questions?
Thank you.
Yeah, one I would like to ask. Here,
Please.
I'm Shahina here. Doctor, you explained everything so very well that everything is well understood. But one thing that you mentioned that you should, get treatment from a doctor who actually explains what is actually happening to you. But I have experienced over the years where my parents
China,
are,
the network, I think it's we're not able to hear you.
it becomes very difficult sometimes to speak to a good doctor because they don't have the time. So how do you handle such a case? I mean, you know that the doctor is very good, but he is not actually explaining the entire process of what is going through. So what the option should be, changing the doctor or sticking to the same one?
So I have slightly controversial views about it. Many doctors view themselves as technicians. They are not really doctors. They will be expert in a technique of therapy. So somebody may say, I'm expert in breast cancer. So they know how to cut upon the breast and close it.
Okay.
And I'm not particularly fond of such doctors. That's a technician's job. A doctor is somebody who will help you to heal. And a part of helping to heal is understanding what you need and providing that. And I again reiterate that doctors are very busy in India. It's a huge problem because we have such a huge population. So you may not have a doctor who will spend 2 hours talking to you, like suppose you go to an American hospital. But if you go prepared with a set of maybe 5 or 10 questions, so that you may have only 15 minutes with the doctor and you may fire those questions saying, doc, I have these questions, you have 15 minutes, please answer all these questions. So, you also have to help your doctor to help you.
Okay, fine.
So if we are crisp, then this may be helpful.
Thank you so much.
Good evening. We are indeed very fortunate and indebted to you, Doctor, for sparing your valuable time for us in spite of your busy schedule. Your talk has been very informative, full of knowledge, building confidence and hope. This is something people dread by the name itself. Your talk has created awareness for the families and their support system as well. It gives a lot of confidence to as you do counseling also. You have made us aware of the effects of cancer, the journey of cancer, and you have made us also, your advice about changing the doctor and to take a second opinion is highly appreciative. Your emphasis on relationship with the doctor also I appreciate. Your concern of winning the battle with cancer needs to be applauded, and I request the audience to please give a big applause. Thank you so much, Dr. Dandekar, indeed.